Prevention Center at the Thomas Jefferson University Hospital. And Dr. Han has devoted her entire professional career to studying hepatitis B. Thank you so much.
Thank you for the introduction, and I don't want to go through anyhow all these thanks that Dr. Mitchell already elaborated. One thing I want to mention before I go on is 20-some years ago, I gave a hepatitis B vaccine to this councilman, David O. He was in DA office. The reason is, among thousands of patients that I have been vaccinating, I couldn't get through the needle because his muscle was so strong. That's how I remember. So he stuck in me. Now I'm so happy to see him in 20 years that he's our proud councilman interested in hepatitis B cause. Where did I give him vaccine? It was right at Fox Chase Cancer Center. You may know hepatitis B virus was discovered in Philadelphia by Philadelphian Dr. Baruch Blumberg at Fox Chase Cancer Center. That was the beginning of controlling, finding, and the treatment of hepatitis B. And we should be very proud of being Philadelphian and having discovered the virus right in our proud city. The majority of HCC that we are seeing, hepatocellular carcinoma, we are seeing among the immigrant population, namely African American, Asian Americans, due to chronic hepatitis B infection. One thing is, if you get the infection, you don't get liver cancer immediately. It takes about 20 to 40 years to get to the stage of liver cancer. What can we do? By simple screening of simple test, hepatitis B virus surface antigen. As Dr. Mitchell said, once we identify the individual who are at the risk of liver cancer, then the second step is following these people. Now we have done massive screening, but the problem is between the screening, identifying the infected individual, let them go to medical help, there's a big gap because not only the immigrants are busy, no medical insurance, the medicine is very expensive. As you know, we have had wonderful, effective medicine for hepatitis B, 5 of them since 1998. And I have to tell you, those who are treated with the antiviral agent, they stay pretty healthy and not progressing to liver cirrhosis. Even we can reduce hepatocellular carcinoma. So our most important duty is not only screening, but follow them through so that they can get proper treatment until we have cure medicine. As you may know, the medicine that we are treating hepatitis B is effective suppressing the viral replication, not eradicating the virus, because even if you suppress, you remain well in the liver tissue, the virus grandpa or grandma still living happily. And once we stop medicine, the virus comes back and they get sick. So the compliance of continuing medicine, but it can be also costly, very expensive because of the insurance program. Some of them I have to treat even 20, 22 years. They remain healthy, but what can we do now? So there was a problem that when we can eradicate hepatitis B, while now we are successfully seeing the eradicating hepatitis C virus. Among the patients who had chronic hepatitis C, I said goodbye after 3 months, happy medicine, they take 1 a day, no symptoms. They were so happy to say goodbye, but they came back 6 months later because to celebrate their eradication, cure of hepatitis C virus. Now, I have to tell you though, recently there are big international meeting in France 2 years ago. All the scientists who are interested in eradicating the hepatitis B virus were sitting together, and I'm happy to show you the list of potential product that can effectively eradicate the virus, which is quite different from what we are treating now. So be assured, we can treat hepatitis B virus completely in the future, maybe in 5 years or in a decade. So this is hopeful. We are seeing this light in the horizon. So in the meantime, what we can do is, instead of letting them suffer from cancer, untreatable stage, we make them aware, so that they can get proper treatment. One example of mine was the man, 52-year-old man, had his mother. She died of liver cirrhosis 20 years ago. He was at that time screened, and he was also infected with the same virus. Since he had no symptom, he was busy with his immigrant work. He didn't care. He ignored for 20 years. Only 3 months before, he found his stool was black, tarry stool. That means he was bleeding. He didn't know what it was. When he came to Jefferson from Washington, D.C., his liver was almost completely replaced by the cancer. So within 10 days, he was gone. Can we have prevented his life? Yes. If there's an alertness, educated this young man who was 10, 20 years older when he lost his mother, we could have saved his life. Now he was only 52. This is just a working example that I'm seeing in my center, that we really, each time when I see this, we really need to educate the public, and also we have to be more aggressive, have them come for medical treatment. Especially nowadays, we are now seeing the future, we can cure hepatitis. Thank you very much.